In the U.S., a black woman with breast cancer is 40% more likely to die from breast cancer than a white woman. In Houston, the disparities in mortality are even higher, according to research conducted by Susan G. Komen.
And now the organization is taking steps in our area to put a stop to the disparities in breast cancer. KPRC 2 health reporter Haley Hernandez is joining us now to explain more on this. Haley?
So Susan G. Komen found that black women often delay screening due to job restrictions, the cost of treatment, and then they can be diagnosed with later stages of cancer. Komen says the solution is their new initiative, Stand for Her.
I don't think there's a word to describe the fear.
Morgan Mitchell has no family history of breast cancer and was shocked when diagnosed at 34 in the middle of the pandemic.
I had a very aggressive type of cancer, and most younger women have aggressive types.
According to MD Anderson, Dr. Abena Brewster, fighting breast cancer in black patients has taken a front and center focus with medical professionals and groups like Komen. Their Stand for Her initiative helps to connect people with quality care in their community, provides information, emotional support, and financial help. Dr. Brewster says while this is a good emphasis, it's still most important to be your own biggest advocate.
Be an advocate in terms of where you get care. Be an advocate for yourself in terms of the timeliness of your care. Be an advocate for yourself in terms of making sure that your questions are answered.
But when possible, plan for prevention more than treatment.
Limiting alcohol intake, avoiding sugary beverages and added sugars, eating a diet that's filled with fruits and vegetables, breastfeeding for as long as you're able.
Morgan, who is now cancer-free, works with Komen to help others like her.
We need to start screening younger. We need to do self-checks younger. We need to be aware at younger ages. All of this makes a difference, and it really does make a difference when someone who looks like you is speaking to you.
And if you do have a family history of breast cancer, Dr. Brewster says you probably want to ask about genetic testing. And for everyone else, the recommendation to get screened is still 40 years old. Dr. Brewster says to remember with self-checks, it will be obvious if something is abnormal. Don't be afraid that you don't know what you're looking for. Keith, Lauren?
Haley, thank you.